Hello, my name is Mary Stone, and this is my PowerPoint for the best interventions for terminal agitation. Quality care is essential for caring for an individual at the end of the life process. Quality care can include comfort measures, activities of daily living, emotional, spiritual needs. About 88% of deaths happen with individuals with terminal agitation. Unfortunately, this is the most misdiagnosed diagnosis. Only about 42% of individuals are actually diagnosed in palliative care with terminal agitation. Terminal agitation can be described as terminal restlessness or terminal delirium. For families who have people that they love that suffer from terminal agitation, this condition can be very upsetting, not only for the caregiver, but for the family and for the individual himself. Terminal agitation has multiple symptoms, and these symptoms can include the same symptoms as delirium, which can be emotional restlessness, confusion, unaware of their environment, sleep disturbances, and also can include cognitive decline. Terminal agitation can happen suddenly over a long period of time. When an elderly individual is suffering from terminal agitation, the best intervention for them is a non-pharmacological intervention, and music therapy is the gold standard for the non-pharmacological intervention for that individual. The individual can become so restless and so agitated that they can remove their own clothing because of the distress that they're experiencing at that time. So once again, it's non-pharmacological interventions are the best interventions to be able to implement for someone who has terminal agitation. You can either have music therapy or you can have therapeutic recreation. The thing is with the therapeutic recreation, these activities can stimulate the mind, and they can also stimulate the environment. And that's not really something that you want to do with someone who has terminal agitation. You want them to be more calm, more focused. You don't want them to be stimulated. The interventions to provide comfort measures for an individual who's suffering for terminal agitation is the non-pharmacological intervention, which is music therapy. Music therapy has been proven with the studies that I've researched to improve the quality of life and provide comfort to an individual who is receiving end-of-life care. These interventions, they help psychologically, and they can also help spiritually with a person who is experiencing terminal agitation. Okay, therapeutic review. There are multiple types of literature review. There's multiple types of literature review. There's qualitative, there's quantitative, and then there's also mixed methods. There's something here I would like to read so I can get the quote correctly. The non-pharmacological intervention should be implemented prior to using medication, because medication and behavioral therapies are implemented to alleviate the level of patient's anxiety and depression. So if you use medicine as part of the intervention to use with someone who has terminal agitation, these symptoms can include lowering the blood pressure or increasing the blood pressure. It can include shock, Also, it could have a drug dependency, could cause the patient to be addicted to certain medications. The point that needs to be stressed when you're dealing with someone who has terminal agitation is comfort measures. Comfort measures are the backbone of taking care of someone who has terminal agitation. And music therapy has been proven with multiple sites and with multiple research to show effective with terminal agitation. One of the things that I enjoyed reading was it talked about how it's effective with spiritual, emotional, but also it can help bring back memories that the person may have lost due to, having terminal agitation. And music is a very big part of all of our lives. And sometimes songs can be connected to a memory. And when we hear that song, it may bring back the memories. Also, music therapy doesn't limit just to listening to music. You can have music therapy if you take part in maybe songwriting or playing an instrument like a piano or a guitar or something along those lines. So, in conclusion, it has been discovered that music therapy does have a positive effect on someone who has terminal agitation. Music therapy helps relieve stress, anxiety, and depression with someone who has terminal agitation, and in turn can improve the quality of life of an individual. And here are my references for not only pictures but also quotes that was used. Thank you.